guys, welcome back for part 2 of our series on headaches. Today we're going to spend some time just talking about chiropractic care. What does that look like? What do we see present to the office? I'll tell you guys that headaches are becoming more prevalent in our community as a result of the evolution of technology. I see so many teenagers, and now it's filtered into adults, and I even have patients in their 60s and 70s who are sitting on their cell phones like this. Okay, and what that does is it creates something called anterior head syndrome, where your head, which weighs about the same amount as a bowling ball, about 12 to 14 pounds, starts to shift out in front, and you start to get this type of appearance. And it can just be a little bit, okay, but for every inch of anterior weight bearing, your head doing this, it puts an additional 12 pounds of pressure on the spine. And so that over the course of 8-10 hours a day, and that's not even including the time that you're at home sitting on your couch, right? An uncomfortable surface. Maybe you're having 3 pillows behind your head and you're shoving your head up like this. You can obviously see how that posture starts to change. It creates muscle tension, it creates soreness, and I have so many people that say that, man, my headaches just start right back here, or they get this tightness, soreness across the upper back, that when they get a headache, they start to notice that first, and then the headache will start to come either up over top or behind the eye or in the temporal area. So this is the result. It is a postural issue that we start to see in the office. Well, when you're chronically sitting in this position, it'll create what's called a subluxation, which is a misalignment of the joint. And it'll start to create tension on the spine. If you were to look at the chronic subluxation issue that we see in society, it'll start to show up on x-rays. So if you looked at a normal healthy spine, number one, you're gonna notice that the head position is directly over top of the shoulders. When that's present, you're gonna see a normal, natural, what I would call a banana-shaped curve in the spine. The disc, in between the vertebrae, that black part right here, will be nice, open, and healthy. The fatter the disc is, the healthier the nerve's gonna be. Remember, your brain's up here, your spinal cord's right through this area, and then right behind the vertebrae, that's where the nerve comes off the spinal cord. And these nerves in the top part of the neck, especially C1 and C2, those go back up into your head. So that's the headaches, migraines, vertigo, cervicogenic headaches, tension headaches, that type of thing. The vertebrae should be nice, square, and boxy. No jagged edges, what we call bone spurs or osteophytes. Well, the problem is that over 5, 10, 15, 25, 35 years of your head being in this position, it changes the biomechanics of the spine, and it'll start to cause a straightening or a reversal of that curve. So rather than that curve going like this, it starts to become straight, or it reverses as in this presentation. And this would be an incorrect, an abnormal, unhealthy presentation of the spine. If you look here, this disc is healthy, as is this one. This one's pretty good, but you can start to see how arthritic or degenerated these discs are down through this area. And this can create a lot of issues with the neck, tension into the head, suboccipital issues, bone spurs, osteophytes, and the spine just starts to break down, break down, break down. And so when we see this type of presentation, this is a classic presentation of somebody who either A, has headaches, migraine issues, or B, or A and B, numbness tingling down into the arms. So a lot of times we'll see those types of presentations together, which makes it more of a complex issue, what we call a radiculopathy. In the next video, what we're gonna do is we're gonna talk about when we see this type of thing, what does an adjustment look like, right? What are we gonna do for that patient in our office over time that will start to calm down the headaches and create more of a long-term change rather than just a short-term temporary fix.